I'm an opiate user, you know what I mean, have been my whole life, and I'm probably overdosed at least 50 times. I've been hospitalized probably 27 times. I mean, been clinically dead like twice. Even though it was killing me, I couldn't stop. The program has just made me a completely different person. My wife doesn't worry about me dying. She tells me she's proud of me. She loves that I'm in the program. The MAP program is pretty comprehensive. I mean, you've got to do a lot of running around. I've got appointments at least 3 times a week usually. To save your life, I mean, three days out of a week, at least you're going to be alive at the end of the week, you know what I mean? You're not dead, it's not over, the game's not over, you know. You still got a life. When
we talk about the MAT program, we're really referring to medication-assisted treatment, and that is more than just us giving a pill to solve a problem. That's really comprehensive care that allows us to not only use medication to support recovery, but it also allows us to treat the whole person. And really at Blue Ridge Health, that's what we've tried to design in a way that we look at patients not just from one perspective. We look holistically at the patient and really determine what support services are needed and really link them into those services.
Everybody in the program, everybody that teaches, instructs, that holds the groups, I mean, everybody, they're interested and they actually care. I've been clean for 5 months. I mean, not using. I've never been more than 60 days without overdosing, never. I used to wake up, I'd obsess on drugs and how I'm gonna go commit a crime to get the money to get drugs, and that was my daily routine for 56 years. And now when I wake up in the morning, I mean, I get up and I worry about what I'm gonna eat for breakfast, you know, and that was never a thought in my mind.
Joseph is really the perfect example of why a comprehensive program is necessary in order to support recovery. So we knew that in order to increase his chances of being successful in recovery, we had to look at things like referring for housing. We had to help him get back to his love of being able to be an artist, to sort of feed his soul in that manner. The recovery is a piece of a larger puzzle of his entire life, and we're trying to be really thoughtful about how we've developed the MAT program. So every patient gets those wraparound services that we know create the most successful environment.
I hope to have my own art studio, or, you know, my own place where I can sell my art and display it. I'm working on a bunch of dream catchers right now for fall, because a lot of leaf lookers come up to Cherokee, so I make different Indian artifacts, you know, and I take them up there and I sell them during this time of the season. I'm gonna try and get my peer support specialist certification. You've been through the drug game, you know the outs and ins of everything. People come into treatment and they don't really know what to expect, and you can tell them what to expect. You can tell them, you know, the pitfalls.
The work that Blue Ridge is doing around the opioid use epidemic is really important for the entire community, and it's vital that the community supports us in this. The things that we talk about when we're talking about children not having their parents to raise them, when we're talking about young people dying of overdose, that's not just a singular event within one family. It has a ripple effect across the entire community.
We really need the community's support, whether that's through government or private donors, in order to help us continue the great work that we do to see patients again in multiple venues within Western North Carolina, provide extensive services to them.
Philanthropy is extremely important to our organization. Without donors, without additional funding, we wouldn't be able to offer all of the services that we have.
Our vision is, again, to be the provider of choice for patients, to be really the solution to the healthcare problem in this country, in North Carolina, in Western North Carolina.
Without Blue Ridge, I know I would be dead by now. Every overdose was getting worse and worse and worse. And then after a while, you just stop caring. Empty days, I was just filling my days full of drugs. It's just, I mean, it's a completely different life than what I'm used to living.
We need community support. We need donors at Blue Ridge Health. And these donors really allow for us to increase our access for services. Donors can support us financially, or they can also support us by being our patient. Neither of these ways allows us to provide care for those that might not be able to afford it otherwise.
Our cost for care to the healthcare system should bring attention to what we do. This is the answer, if you will, to our healthcare crisis.
It's saving lives. I mean, there's no better way to donate your money, because this is actually going to help somebody live.
Blue Ridge is definitely a good investment because we're always going to be serving at the community level as a community health center. And I think that that's just a way to kind of give back to your own community. Tons of stories about patients who, were desperate. They had no other place to go. They were kind of at the end of their rope, so to speak. And Blue Ridge was able to be there for them at that critical moment.
I've got two daughters, 35 and 32. And I've been to their houses with their kids and not even remember going. I would just be drunk and loaded up on dope. And we lost contact through the years. And now, I got contact back with my children, and I got 7 grandchildren that I go see. So just makes me happy just to be with them. Well, I say thank y'all. Y'all saved my life. I wouldn't be here today if it weren't for both. The donors and the staff that helped me with, get my life together. I'd be dead. I know I'd be dead. Just that simple.